Hey Guru Nation, where you're about to watch is a clip that I specifically took out of one of our recent Latinos in Clinical Research interview. We actually brought on a financial advisor, a CPA, and a investment specialist strategist, and the conversation turned into why everybody in healthcare, and especially clinical research, should consider having a side gig, so a business on the side, specifically for tax purposes. But also, Eddie, who's the financial advisor, said something interesting. He said 9 to 5 is how you pay your bills, all right? But your business, even if it's a side business and a part-time business, what you do after working hours, before and after work, that could be the difference between whether you are financially free at some point or whether you're always going to need that W-2 job. So this clip from the Latinos in Clinical Research episode, I'll have the link to the full video underneath this in the YouTube description. Just click underneath. Make sure while you're there, subscribe and like and hit that bell to get notifications. But very interesting. Let's think about, and I'm going to go in depth on this, why I think every single W-2 employee who may not even be thinking about starting a business on the side should consider it, even if it's just a one-person business, a self-employed business that you do in your spare time. You can do things in clinical research. You already have the knowledge, if you work in healthcare or in research, to have a successful, even a small 20, 30,000 extra dollars a year, plus the tax benefits. Something to consider. I know it's not for everyone. I know not everyone's entrepreneurs, but who doesn't want to save taxes? Who doesn't want financial freedom? Something we don't really talk about much. So let me know what you think in the comments. Catch y'all later.
Now, Eddie, there's two kind of people. I think there's the employees and there's the business owners or self-employed.
Right.
So as far as employee, just W-2, there's nothing really you can deduct other because it's already all taken out, right?
Yeah, unfortunately.
There's nothing for you if you're
Yes.
W-2.
Right. As of 2017, when they changed the tax code, part of the code that was changed was the unreimbursed employee expenses. When in the past, if you were a W-2 worker and you had expenses for work, you were able to deduct it on your Schedule A, okay, which is itemized deductions. So as of 2017, they took that out, and you can still deduct it, but off of your state taxes. So I mean, if you're still W-2 employee and you don't get reimbursed for expenses from work, at least in the state, it'll help you, okay, but not on the federal taxes.
Now, could these employees, these W-2 employees, we have a lot that watch, some of them doctors, right? I'm telling you, doctor no different than somebody. So, no offense, Dr. Al, you're not like these doctors, but you're a business person. But doctors are just like anyone else. You're gonna be W-2. Some of them just work for a hospital, and they can open a business on the side, right?
Right.
There's no
Absolutely.
laws against this.
No laws. As a matter of fact, the 9 to 5 should be there just to pay your bills. What you do outside of 5 o'clock, after 5 o'clock, is going to make you successful, even more successful.
Yeah.
Wow.
Right?
You hear that,
100%.
Ashley Margot,
Yeah,
you hear
Wow.
That's why I'm here. That's why I'm here.
Exactly. Yeah, I deal with a lot of entrepreneurs, and that's some. When you work for somebody else, you're always at the mercy of them. That's why, like I said, at first I was an electronics engineer, but I saw that, heck, I could only go as far as they let me. I love electronics. I love all that, but now I do it as a hobby. Why? Because I'm a business owner. I control my own time. I control what I do. There is no limit to the income I can make. Right. So, yeah. And I mean, it just makes sense because you, as a W-2, we're not telling you quit and become a business owner. No, definitely. It's a step-by-step process. But right now, just starting a business on the side, your side hustle, that's going to help you deduct all those taxes that you owe. Because
Yeah.
obviously, at the beginning, you're going to have a little bit of expense to start it off, like any business.
And here's how much the government trusts you guys that are W-2 employees. They don't trust that you can manage your own money, so they take your taxes every 2 weeks from your check because
Absolutely,
they know they can't trust you with that money. Business
absolutely,
owner, they can trust you a little bit more.
right.
W-2,
You have no choice.
we don't believe you're gonna pay us. We're gonna take it every 2 weeks from your check.
As a matter of fact, if you don't pay 90% of what your taxes are owed, they're going to penalize you
As
at
a
the end
Yeah.
W-2.
as a W-2. That is correct. Yeah.
So I
So,
guess the lesson is to start a business, even if you are a
Yeah.
W-2. Anything, make it a
absolutely.
hobby, but 3 to 5 years, got to make a profit,
Yes.
or else it's a hobby.
Exactly. So
Absolutely.
So for
I had
all
a
those
question.
doctors out
Yes.
there,
Seriously. Yes. We
should
need
be
to. We need to
part
make.
now of research.
Yes, thank you. Join the
Exactly.
circle, and we will teach you. We will open your eyes to see the world of business like you've never been seen it before. It's a new world.
Absolutely.
This is your
Especially if
W-2 is like this, and then the business is like, you're like awake. You're like not in a cave anymore. You know,
absolutely.
Hmm.
Yeah,
cave where you see
and it's
shadows, and
scary.
that's reality. That's not reality.
Yeah, Dan, and I mean it's scary because I mean you people are so used to going in, clocking in, having a check for sure every week, right? Every 2 weeks, and yeah, becoming an entrepreneur is scary. But you know what's scarier? It's being where you're at. You know,
Exactly.
being always there. You know, having someone control you, control what you drive, where you live. You know what your children are gonna learn. That to me was scary. You know, so I mean, I hope I'm not offending no one by saying all that, but it's just that I want you guys to open your
Good.
eyes and
We are.
understand that.
We're.
that yeah, I mean,
Don't be offended.
yeah, it is uncomfortable. It is
Yeah.
uncomfortable, super uncomfortable. But you know what? It's well worth it. Definitely
And
worth it.
doctors are the ones get taxed the most.
They
The
do.
high income. I mean, again, Dr. Al is not the example because he's an entrepreneur. This guy has so many businesses; it's unreal. Dr. Al, we can do a whole podcast on all his stuff he does. But I'm talking about your regular doctor that comes out of a medical school with like $400,000 in debt, and then get becomes an employee of a hospital. Okay,
Right.
like not only they're look how far behind they are already, right? And now they're just getting taxed, and the higher income, the more tax you get, and they don't have enough. The thing with doctors is they have to this lifestyle to live up to, so they have to buy the latest car, and so
Mm,
if you don't have a business, and clinical research is a great business for this. If you don't have a business, you're not going to have opportunity to create like higher income that you can offset and then start investing it, for
Exactly.
capital assets appreciation. So doctors are like, unfortunately, like the biggest victims in all this, the ones that are W-2 employees and
right.
fresh out of med school. And the days of the entrepreneurial physician is coming to an end. I mean, all these people coming out of med school, Kaiser gives them $300,000 to start, and they don't want to see anything about any business. They just, I want to work for Kaiser for the rest of my life, pay off my student loans, and 300,000 is great. But by the time they get taxed, they get 150, and then they buy the new BMW every year.
Yeah.
And then
Absolutely.
they lose their skill set on top of that. That makes them the
Eh,
ability to be able to go on their own and actually create
Right.
their own.
I think for physician or non-physician, it's up to the person himself to be entrepreneur or not. Okay,
Hmm.
I think any physician he choose to go to work for Kaiser, work for any company, or work for himself. But always the hard way is to work for yourself and start to establish from zero. As Ashley doing, she started from zero, and it's not easy to go even in research, not in
Yes.
medicine,
Ashley
even in research.
Scrappy. Ashley Scrappy.
Yes, I am.
Yeah. So it's always like depends on the person, on the individual personality, what he wants to do. If he's a fighter, he's ambitious, he wants to go for more stuff. I think that's his choice,
Oh,
but
yeah.
it's not going to be easy.
No,
Hmm.
it's not. No, it's not. And obviously, I mean, at the end of the game, what you want to do is be able to retire comfortably, right? I mean that's why they think that having a job, having something secure, having their 401k is gonna grant them something comfortably, right? Uh,
Mhm.
but obviously we want to be more than comfortable, right? So I mean, having a business is also, I mean, instead of having a 401k where you could only put 19,000 a year, you could have put up to 25,000 into a retirement account for yourself,
Hmm.
Yeah.
right? So there's so many benefits.
For the SEP IRA, right?
Yes.
Yeah.
And I think something that needs to be said is also that even if you're coming straight out of school or you're coming into this new business or trying to get into your business, you need to understand too that you're also adapting. So even as you are becoming profitable, you are adapting to that profit. So that's, I think, why it's also important to make your own business because you're constantly allowing the room for expansion and you kind of control that expansion, right? Depending on how much you work or how innovative you want to be. And as opposed to a job or W-2, there's kind of like a blockage and there's somebody there determining how far and how fast you move forward. And I think that that in
Mm.
itself is very limiting.
Hmm.
So,
Absolutely.
yeah. Mhm.
Absolutely.
Very good point, Ashley.